we really don't know much about the relationship of nutrition and dementia prevention. In fact, the majority of studies have not shown that nutrient interventions are associated with better cognitive outcomes. And the reason why we did this symposium is because observational studies have consistently shown that a certain diet, for example, the Mediterranean diet, is associated with better cognitive function. So how do we translate these observational studies into effective clinical trials? And that was the purpose of the symposium that we had last year in the Alzheimer's Association. The symposium was funded by a grant from the National Institute on Aging, where over 20 experts from all across the world met over a period of 1 year, several times, and eventually participated in a symposium on the end of June of 2021. So one of the two main findings from the symposium were that going into the future, we should probably focus on two kinds or two types of research in nutrition and dementia prevention. One is personalized, small scale, that requires a lot of biomarkers, where you, let's say, take a specific small population that is either nutrient deplete. For example, they don't eat enough fish, they're omega-3 deficient, or they're vitamin D deficient or vitamin D deficient, and then provide a supplementation and look at biomarkers to see if the actual levels are going up, and specific imaging in the brain based on how these supplements work. This is a small scale, intensive, personalized intervention that is based on how a supplement or a vitamin or a nutrient works. The other direction that the symposium came out with is really a larger scale population-based study. And in this case, practical outcomes are measured in a big portion of let's say a population, and then the intervention will focus on patients with risk factors for dementia, for example, vascular risk factors such as obesity, diabetes, hypertension. And then the outcomes would be practical outcomes like electronic health or immobile outcomes, and ascertainment of diagnoses like dementia. So this large scale overview approach is more practical. It involves a large number of people. It follows them with surrogate outcomes in a few years, because it takes a while to develop dementia. And legacy studies can actually last decades after that trial concludes, to ascertain or to find out if those who were allocated to the active intervention had less dementia compared to those who did not. Those large-scale outcomes can be multimodal. They include diet, changes, exercise or lifestyle, cognitive training, and multimodal domains, which are based on good science relating to improved brain cognitive functions.